the key issues that are of interest to CDER right now and identify some regulatory hot topics, which means that you can bring up issues you want, but our panelists can also bring up issues. If there's anything they wish they had said in another session or they want to make sure you're learning about, then this is sort of their last opportunity. I'm going to introduce who's here, and I will introduce the others later. Starting, we have Tom Abrams, who is the Director of the Office of Prescription Drug Promotion. Mainly this is advertising in the Office of Medical Policy. Now, from some experiences I've been having lately with people from other countries, I know that this is a major issue because prescription drug advertising is not allowed in most of the world. So I know you'll all be interested in what he has to say. Next to him, we have Gerald Alpan from the Office of Surveillance and Epidemiology. I keep wanting to say drug safety, which is what it used to be a long time ago. Then, moving forward, we have Bob Temple, who is the Deputy Center Director of FDA. I'd like to start with each of you just saying a few words, like 2 sentences, about what your group does. But in the meantime, Teresa Mullen is joining us. Where are you? She's here. The Director of the Office of Strategic Programs. So, Gerald, would you start just briefly?
So good morning, I'm Gerald Alpan. I'm the Director of the Office of Surveillance and Epidemiology at CDER. Our office has long been considered a post-market office, but we estimate that around 30, maybe even 40% of our work is pre-market. We're responsible for pharmacovigilance, which is the review of the over now 1 million adverse event reports we receive through our affairs system every year, pharmacoepidemiology, which is a population-based study of the safety of medicines. That also includes drug utilization, medication error prevention analysis. That includes the review of proposed proprietary names, as well as carton and container labeling and drug-device combination, the device portion of drug-device combinations for usability testing, as well as the Division of Risk Management, which works on all the REMS. So a lot of the REMS work is pre-market and pre-approval, but certainly continues in the post-market. A lot of the medication error work is very much by design in the pre-market, quite early on sometimes in the early development phase, so that we can avoid error-prone aspects of the design of a product. And the epidemiologists and the pharmacovigilance people are often involved during the NDA or BLA review cycle, both at the mid-cycle and the late cycle, to talk about what plans might be necessary, either for FDA or for the company, in terms of post-market safety surveillance.
Tom?
I'm Tom Abrams, Director of Office of Prescription Drug Promotion, or OPDP, and this is the office within CDER that has oversight for the promotion of directed to both healthcare professionals and to consumers. Our 3 objectives coming from FDA's overall goal to protecting and promoting public health is to ensure that prescription drug promotion is not false or misleading, to ensure that it's balanced, that a candid representation of risks are included when the benefits are presented about a drug, and to aid in more useful communications and information about prescription drugs and medical diseases in general. So bottom line is we want credible, useful information for both healthcare professionals and consumers. And we accomplish these objectives by having a multi-component program, and that consists of an enforcement program. Also, voluntary compliance. We spend a lot of resources on voluntary compliance by developing guidances, by providing comment on draft promotional pieces for advisory requests, and also doing a lot of outreach. So we are an office of 70 folks with different disciplines, healthcare professionals, lawyers, and social scientists, and we're grouped into three major groups, two divisions that review promotional labeling and advertisements, as well as draft labeling, anything related to prescription drug promotion, and another group that works on policy and social science research.